Good audience. Okay, well, how healthy are you? Do you know that a solid, strong body starts right here in your mouth? Dr. Simpton with the Smile Center is here with some news that I think is worth smiling about. Dr. Simpton, thank you for being here this morning.
Good morning. Thank you for having me.
First of all, tell us a little bit about, for people who are unfamiliar with the wonder, I say, of the Smile Center. Tell us about it.
Well, we're a local family-owned and operated dental office. We have 5 locations serving most of, the San Antonio area. We see the full family. That's the main thing that we focus on, is that full family service, that one stop where everybody can get taken care of.
Yeah. What you're talking about this morning, I think, is going to be eye-opening for a lot of people if they don't pay, that much attention to oral news and health news as it relates to teeth. But I first heard about this when I was in college last year. No, in a health class, that the mouth is the gateway to the rest of the body.
That's absolutely right.
Talk about that.
Well, every, study after study shows that connection between the mouth and the rest of the body. And we do have this display here that does represent that. Basically, if you have periodontal disease, if you have inflammation, cavities in your mouth, that it has a negative effect on virtually every other chronic disease there is. Okay, so you think about heart disease, you think about stroke, diabetes,
I even
arthritis,
heard Alzheimer's. Did I hear that?
Alzheimer's, anything that's a long-term kind of condition that develops over time. If your body is circulating bacteria throughout it, it's going to have it's going to increase the effects of those conditions. So like perfect example, heart disease. Well, if you have a clotting of the arteries, if you have bacteria in your body that's going through your blood, that coagulates with the platelets and adds to that clogging. So every disease is kind of exacerbated by the fact that if you have that bacteria flowing around in your body.
Yeah, and then I read that there are more than 300 types of bacteria. So you're talking about something that just a good old-fashioned brushing and washing won't take care of.
Well, the brushing and washing on a daily basis, if you're very vigilant about it, that's what will keep you clean. And then, of course, obviously, what we really emphasize is those visits.
The visits, the treatments.
And one of the things I'd like to highlight is our First Dental Home program. Okay. We start seeing children at 6 months old, okay? And what that's going to do is that's going to establish that relationship between the patient and the family and their dentist, so that throughout the course of a person's life, they're growing up, getting those regular checkups, and that way nothing gets too far along before it's detected and taken care of at the dental office.
Yeah, you say knowledge is power.
Yes.
Because the sooner you start, the chances of you having a healthier body because you've got good oral hygiene is almost guaranteed.
That's right.
Yes. Now, you talk about the fact that, because parents are the models. If parents practice good habits, kids see this and they are more likely to be lifelong practicers, if I can make up that word.
Yes, and that goes right into the First Dental Home program that we provide. Part of that visit is education to the parents, how to brush the teeth, setting them up on that 6-month recall. So we're giving them all the information that they need during those visits to have their children grow up in a healthy lifestyle, as far as their mouth is concerned, what's appropriate for kids to eat, how to, bottle, when to give them the bottle and when not to give them the bottle. And all that is very specific, and you just don't know that until you go to the dentist and they tell you about it.
Right. So brushing is not enough. You have to do it consistently. You've got to keep up with those treatments, and also a big thing, flossing.
Yeah. Well, and with flossing, if you floss and you see that your gums are bleeding, that is a bad sign, okay? Because that bacteria that we were talking about, if you floss and you're bleeding, if your gums are bleeding, well, your body is taking that bacteria into it and again circulating it around. So if you see any bleeding, any swelling, those are telltale signs that you need to get to the Smile Center and get taken care of.
Of course, Dr. Simpton. And you have a beautiful smile. You have a gorgeous smile, if I might say that myself. Listen, let's tell you where the Smile Centers are located. You can find a Smile Center near you. Here's one, 907 South WW White. This is a summer smile wash, free car wash with dental visit, Dr. Simpton.
We're having basically a big party tomorrow from 12 to 2. We're going to be having games. We're going to have, 98.5 The Beat's going to be out there. And most importantly, we're going to be doing the free dental screenings. The whole family can come in, and we're going to take a quick look and see how things are and give you that initial impression from a dentist point of view of how you're doing.
That's tremendous. Give people a jump start on good old hygiene.
Exactly.
And again, there are 5 locations near you for the Smile Center. Check them out. The SmileCenterUSA.com has a list of all of those. Or you can go to our website at kens5.com/greatday. Dr. Simpton, thank you so much.
Thank you so much for having me.